Okay, let me talk about one specific hospital. The Irish Times today are reporting that the Secretary General at your department, Robert Watt, wrote to Bernard Gloucester, the head of the HSC, last October, specifically about weekend consultant cover at University Hospital Limerick, and said it was an issue that required, quote, urgent attention. Now, this letter was written 4 months ago. Looking at the trolley figures, Limerick is always up there when it comes to the numbers. What has happened since then, do you think?
Well, Limerick has been persistently difficult and has the highest trolley numbers in a consistent way. It's also the hospital that has benefited more than any other in terms of investment, additional bed capacity, additional staff. And there is more to do. There is a capacity issue there, but that still doesn't explain the very high trolley numbers and the spikes at weekends. And there is more to be done. And that is very clear recommendations from the Frank Clark report into the death of Eva Johnston, that there is more to do culturally in Limerick. And I expect that to happen.
I'm asking
I think
specifically, I suppose, what has the HSE done since that letter was written by the Secretary General of the department last October, 4 months on?
I can't account for that period before I became minister, but what I'm saying to you is that we are getting the data on specifically what every consultant, including consultants in Limerick, have been doing, are doing, and are planned to do. So we will have visibility as to, are they doing outpatient clinics on Saturdays? Are they being rostered over the 6 days instead of just the 5 days? What time are they there until? And it's my expectation that they should be working along their own contractual terms. And let's remember, not all consultants are on that contract, to make sure that in the interest of patient safety.
We know it's not just actually about consultants, that
Correct.
there needs to be a proper infrastructure in place across in order to provide a 7-day health service. Are you confident and satisfied that there is that infrastructure in place across hospitals?
No, we have work to do. So, for example, the underlying capacity issue has to be addressed by me and by the government in the funding for the surgical hubs and for our 4 elective hospitals. Now, a good step was taken last week where we opened our first surgical hub in Mount Carmel. That's going to take 18,000 outpatient appointments and 10,000 minor surgeries out of acute hospitals. We need to move scheduled care, elective care, scheduled operations away from our acute hospitals. And we need the rest are being built at the moment, and the elective hospitals are a huge focus for me. So that is something that needs to happen. Yeah. We have more healthcare workers, doctors, nurses and healthcare staff, but we need more, and we need more beds. But that's my responsibility to deliver that infrastructure and the funding for that. But that cannot explain the weekend spikes that are occurring, because they're so limited and they're so obvious in time. And then we spend Monday and Tuesday correcting the imbalance, and the hospital system has to spend those 2 days doing that, and the wider regions, the step down facilities and so on, which also have to be there to support hospitals. There is an infrastructure question. I am working on that, but it does not explain this weekend spike.
Okay.